Welcome to another episode of 10 Minutes. My name is Skylar McGoy, and today we're going to take a look at two similar professions, which may sound the same, but are two very distinct jobs. I had the opportunity to interview Roy, a general oncologist, and Ruthvik, a radiation oncologist. Hey Roy and Ruthvik, nice to have you on our show. So what exactly is your profession?
I'm a general oncologist, and I'm a radiation oncologist. For those who don't know who oncology is, it's basically a branch of medicine that deals with study with treatment, diagnosis, and prevention of cancer. Okay, you can stop that.
So how many years of school is needed to achieve a successful degree in oncology?
So becoming a doctor requires a lot of training in medical school. Around 4 years of medical school, then 4 years of additional training, and then 3 years of further shadowing, job shadowing, all that. So overall, you guys could say at least 11 years, and it could be even more than that for specializations like Ruthvik.
Wow, that's a really long time in school. Was it worth it in the long run?
I really believe that the schooling we went through, Johns Hopkins Medical School, as Roy said, for a lot of our life, I really think it was worth it, and it was really valuable to us. And look at us now; we're making a bunch of money, and we're living happy lives.
You both graduated from the same school?
Yeah, from Johns Hopkins, just like he just mentioned.
Wow, that's a very prestigious school. So how much money do you make once you start working?
So depending on the subtopic in oncology, it depends on how much money you make. For example, me, I specialize in radiation, and I make around $450,000 a year.
Wait, so just by specializing, it can differentiate the money you make?
Yes, you're precisely correct. Yeah, as for me, I didn't specialize. It's something I still enjoy doing, but I earn less than him considerably, almost half, $250,000. But it
must be a lot of stress.
It comes with a lot less stress, and I enjoy it maybe more than he does. I can't say for sure, but yeah.
You mentioned something about board certifications. How do those help?
So when I was doing my residency, I reached out to the various branches of oncology, and then I realized that those, while they do give more pay, it wasn't correct for me. I wanted to deal with a broader range of topics. I wanted to keep up with certifications, board exams, and that eventually led to me being a member of both American Society of Hematology and the American Society of Clinical Oncology, and I'm also board certified for internal medicine, so I can branch out into a more variety of topics. Well, Vic is limited. Even though he might enjoy that more, I like a more broad variety of cases, and I can interact with a broader level of patients, and that's what I wanted.
Wow, the medical field never ceases to amaze me. So for any aspiring oncologists out there, how hard was it to get into the position you are in?
Depending on the subject of matter, the more schooling you have, the better equipped you are, and the more money you make, really. Yeah, so for radiation oncology, there's not much to do after clinics. I obtained my license, and I directly went being into a hospitalist. I'm still in the same position for the past couple of years as Roy and I graduated from Johns Hopkins Medical School. I've been staying in the same position for a couple of years now, and it was, there's a little things you start out with, when you first get into the radiation oncology, but after that you stay in the same position, and I've been there for quite a bit now.
You guys still have big plans, huh?
As for big plans, we actually were thinking of setting up a hospital in Apex. It's because there's none of that kind in this area, so it would consist of a medical oncology, which I would be the head of. I was thinking of getting Vic, if he was interested, for the radiation part, and then we were planning on hiring another prominent surgical oncologist. So it could be a one-stop place for patients to deal with all their oncology problems. It would be the state-of-the-art facility. It could cater to all the possible patients' needs. I really don't think there could be a better thought. Hopefully it works out. We need the funding and all that, but that's something we're going to look forward to. And like he said, even though he was in the same position, his pay did increase. So loyalty does play a big part in the medical field, so we're going to keep a lot of things in mind when we're recruiting people.
Honestly, that is a great idea. I hope you guys can achieve it.
Yeah, thank you, but for now, we just want to build a good patient base. We've been going strong for a few years. We've got loyal patients. They're sticking with us no matter what happens. But there are a lot of risk factors. We need to keep those in mind. Always do what's within our limits. Never cheat the system. Money is a big part in today's society, but we need to do what's right for society, right for humanity. That plays a big part in the medical field. But we're going to be working towards building our patient base, and then ultimately get our own hospital. That's the dream of any doctor, I would believe. And we both just want to be successful. That's what we want to do. Yeah, so as Roy just mentioned, we really are pulling in ideas together, and we're trying to figure out like where, as he said, a good place. Like, I do agree with Roy. Apex is a good place. I mean, we could also build after a couple more years, after we get like our things adjusted, maybe build some more oncology, you know, in bigger areas like such as Charlotte, Wilmington, Cary, Raleigh, you know. I mean, other than that, I mean, we've been in the same position for about a couple of years now, and we love it. So like, that's it.
Go.
You guys seem to have a strong grasp on what's going on. Any potential risks?
Oh, thanks for mentioning that. We really don't believe in Obamacare. We really hate it. I think it's really destroyed the medical like benefits of like, you know, doctors and how they've like associated with the people. I mean, I think it's destroyed like the medical situation in America, and I really hope the next president will have to obtain this problem and try to make it better. You know what I mean? Like, he needs to like make it the benefits of the doctors. He needs to like care for the people. I mean, we're the ones taking care of people, and if he doesn't do that, then I don't know where we're gonna end it. Yeah, sorry to interrupt you, but I mean, it's a big part. I mean, we need to have satisfaction when we're treating our patients too. I mean, Obamacare, while it does, Medicare and Medicaid, they all are prominent issues. I mean, Obamacare, we just feel it messed it up. We're not supposed to voice our personal opinions, but I mean, we thought it was necessary just to know our frustration, and like, because the government needs to start catering to our needs too. I mean, we're also a major part of society. Right, and as he said, like, so like the influx of like AIDS medicines has gone from $13.50 to at least $750 per pill. I mean, that's crazy. I mean, if our patients can't afford that, then how are they gonna like sustain their lives? I mean, they're basically, they just come to us and they ask for help, and if you can't help them, there's no point. Yeah. So, we can never avoid risks like that. We never know who's gonna come in and buy up a company and then raise the market so much. Like, that was like what, a $8,000 price increase. No, we'll edit that. Yeah, that's it. Okay.
Now that we've interviewed our doctors, let's take a look inside their clinics and see how they interact.
Hey man, how you doing?
Good, you?
Yeah. So what's up with your smoking now? How's your?
I'm still smoking like 3 packs a day.
3 packs a day.
3 packs a day.
That you said you were doing 3.5 before. There's no difference. What?
It doesn't matter.
Doesn't matter?
Doesn't matter.
How's that lump on your neck? What happened?
Well, my friend gave me this and said if I put it around my neck, I'll make it go away.
That?
Yes.
Give me that. What are you doing with that?
Well, he said if I put it around my neck, it'll make the lump smaller and make it disappear.
First of all, you have oral cancer. Do you know what oral cancer is?
Isn't that like cancer?
Okay, why do you get that? Do you know why you got that?
No.
You've been smoking. You need to stop. You know? Be cool. Don't be a smoking fool. Okay. That's enough for now. Let's take a look at your lumps. Let's see how it's going. Looks like you've developed a localized solid tumor. You'll be needing radiotherapy. I can refer you to a good radiation oncologist. He'll take care of you.
Why can't you help me?
I mean, I'm not certified. I mean, I'm not that good enough. Why? You have a problem with that?
Well, I'm just asking, why can't you treat me?
Oh, I'm not like certified. I'm only certified for medical oncology. My colleague, Dr. Ruthvik, will take care of you on that.
Okay, thank you.
I mean, that's the best I can do.
Thank you.
Yes. How's it going?
Good, you?
Doing well. So I guess I've heard that one of my good friends, Roy, at the General Oncology, referred you to me.
Yes.
Yeah, so you're going to be in good hands. So I'm specialized, as he might have told you, and I'm specialized in radiation therapy. And he said that I went to the briefing, and he said that you have like a localized solid tumor, and you're going to be good hands. I got that covered. I've done it before, and you're going to be fine.
Mm-hmm. Thank you.
All right, just cut it off.
So what are the treatments?
So we're going to give you radiation therapy, and it's like, it consists of like nuclear like fissions and stuff. It's gonna like take out all the tumors that you're gonna have.
So it's like a bomb. Are you a terrorist?
No, like
terrorist?
Why? I'm specialized in that. What, dude? Don't you trust me? I've gone through a lot of years of school. I went to shit. Shit. John Hopkins.
I went to Ivy University.
John Hopkins Medical School.
Oh! My ankle! Oh my god! Ah!
There's a lot of legal requirements that are going in this process, and Roy and I have a perfect record. None of our patients have left, and they've all been treated by us, and they've all survived and they're living happy lives.
You F up, I will sue you.
You will not sue me.
I will take your wife, your dog, your children, your house, everything I will take from you.
Okay, well, if we don't make you survive, you can do whatever you want.
Okay.
But if we do, you are not coming back, touching neither Roy or I.
Why would I want to
Property.
touch you? I don't want to touch you.
No, none of our property.
Ah, gotcha. Okay.
All right. All right.
What's the next part?
So when will the treatment be done, and when will I go back to my old doctor?
So the process is gonna take about 2 to 8 weeks or a couple of months, and we're gonna keep giving you like radiation therapy. And once we see like progress, and then I'll send you back to Roy. He can do like a general overview briefing, whatever he wants to do. And if he thinks it's not good enough, then he'll refer you back to me, and then we'll just continue more and more.
I don't want to do that. I'll just stick to this holy rap.
No, I read the briefing. He said that you smoke 3 packs of cigarettes a day. That's crazy.
So what? Snoop Dogg smokes more than me.
No, well, I mean, that's Snoop Dogg. I mean, do you think he's gonna live a long life? Like, look at Wiz Khalifa. Do you think he's gonna live a long life? He's like smoking weed all the time. I mean, come on now. You gotta be a fighter. Put down the lighter. You gotta do it.
No.
You gotta do it.
Let me live my life.
No, I mean, we want you to live a happy life.
You're not my mom.
I don't care, but I'm your doctor. You were transferred from Roy to me, and we have a perfect record. We're not gonna let you die. Not like this. No, it can't be done.
Okay.
So what's your choice? What are you gonna pick?
This. Goodbye.
Countless people die from smoking every day. It needs to be stopped. And it starts with you and us.